they're drawing up the vaccines, which are then administered over there.
The mass vaccination clinic in Salem is supposed to be for people in the 1A group, healthcare workers, caretakers, people who live or work in long-term care facilities. But based on the emails and messages we've been getting, a lot of people outside of 1A are getting the vaccine there too.
And my wife and I are in our early 70s, and my wife has asthma, and I thought, what the heck, let's give it a try.
Brian Hines heard people outside of 1A could get the vaccine on Facebook.
When you showed up, were you truthful? I mean, did you tell them your age and, did they know that you weren't part of that 1A group?
Yes, absolutely. I mean, the way it worked, there was a long line of cars, kind of like Disneyland. You wend your way around, you think you're up to the end, and then the line keeps going until you get under a covered building.
Hines, who wrote about his experience on his blog, said he and his wife signed up online. His wife told the National Guard member who they were and why they were there.
We wanted to be truthful, but also persuasive. So she said, he said, "Are you a healthcare worker?" And she said, "No, but we're over 70. We have pre-existing conditions, and we have an appointment that we made through Salem Health's My Chart," which was all true. And I think he paused for a few seconds and said, "Okay, you're good to go."
Hines is far from alone. We've heard from a lot of people out of 1A who went to Salem and got the vaccine too. While Salem Health is explicit on their website that only people in that 1A group should go there to get the vaccine, the clinic does not require any ID to prove they qualify. A Salem spokeswoman also said some vaccines have been given to people out of 1A instead of throwing away doses, but she doesn't know how many. She said the self-attest system relies on the integrity of Oregonians to honor phasing guidelines.
It raises, enormous health equity and justice considerations. And
Dr. Courtney Campbell is the director of the Medical Humanities program at Oregon State University. He said this priority system won't work if it's not strictly enforced.
And you don't want to have people sort of jumping the queue because then, people will feel resentment about not being able to access this particular facility, or they may feel that someone else is getting an unfair advantage over them.
Same goes for all the people in Oregon asking if they can drive to Washington to get the shot. Campbell said states were given vaccines based on population, and going to another state messes up the system.
It's a very scarce resource that's life-saving, and so it can't just be every person for themselves, okay? We need to really band around the common popular culture phrase, we're in this together. And being in this together means looking at the common good, not what's sort of how I can best get advantage.
Hines has no regrets, but said the system does seem unfair.
I'm happy I got the blog shot, the COVID shot, but there's a little bit of a feeling that there was some unfairness to it, which took some of the pleasure away for me.
Yeah, I mean, you're not a healthcare worker and everyone wants the vaccine. So yeah, do you feel bad? Do you feel like maybe you shouldn't have done it? Or are you glad that you did it?
I'm glad that we did it, partly because of my wife, partly because I have some, health problems. We answered all the questions, filled out the forms, so everything was done by the book. It just wasn't by the book according to Governor Brown's and the Oregon Health Authority's 1A priorities.
We reached out to Washington state health officials about this. They said they're not going to be checking residency, and people who live in Oregon and work in Washington may get it from their employer. Clark County officials were more blunt. They said if you live in Oregon, do not drive to Washington to get it. They don't have enough vaccines for everyone. What are your thoughts on this? We would love to hear from you. So many of you have already weighed in on Dan's Facebook post when he asked about this. So head to his Facebook page or use the hashtag HeyDan. We would love to know your thoughts.